Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, everyone, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at the state of America's health and the rise of chronic disease. We're going to discuss why so many people continue to struggle with issues like heart disease, cancer, and diabetes, despite the U.S. spending over $4.5 trillion annually on healthcare. Joining me is my co-host, Ilara Sky. Thank you for being here to share some detailed insights on this vital topic.
Thank you, Ethan. It's a privilege to be part of this discussion. We have seen a steady rise in chronic illnesses, even though we have more hospitals, advanced treatments, and medical interventions than ever before. Our country's leading causes of death, heart disease, cancer, and diabetes, are largely preventable, but the current system tends to focus on managing symptoms rather than correcting underlying factors like metabolic dysfunction, chronic inflammation, and exposure to toxins.
Exactly. What strikes me most is that nearly half of U.S. adults, about 47%, have high blood pressure. Many don't realize they have it until a life-threatening event like a stroke or heart attack occurs. When we look at heart disease specifically, it still kills one person every 34 seconds here in the United States, accounting for roughly 700,000 deaths each year. That's an enormous toll.
And that's just one piece of the larger cardiovascular puzzle. Coronary artery disease, for instance, is often asymptomatic until plaque buildup leads to a major blockage. In many cases, the first warning sign is a serious heart attack. Heart failure, which develops over time, affects over 6 million Americans. People may notice persistent fatigue, swelling in their legs or abdomen, and increasing shortness of breath with mild exertion. Strokes are another critical concern, ranking as the 5th leading cause of death.
Let's shift to cancer. It's the 2nd leading cause of death in the U.S., with over 2 million new cases reported in 2024 alone. Researchers have linked cancer not just to genetic predisposition, but significantly to metabolic health and lifestyle choices. Poor diet, chronic inflammation, and environmental toxins all create environments where abnormal cells can thrive. Lung cancer leads cancer-related deaths, while breast cancer remains the most common among women. Meanwhile, prostate cancer is the most frequently diagnosed among men.
That's correct. Lung cancer remains the top killer, partly because so many cases are linked to smoking. Yet exposure to radon and pollution also play a role. Breast cancer affects hundreds of thousands of women each year, and factors like obesity, insulin resistance, and high sugar intake can elevate the risk. Mammograms are often recommended for early detection, but they have well-known limitations such as radiation exposure, false positives, and in some cases, overtreatment.
Shifting focus to diabetes, it currently affects 38.4 million Americans, representing about 11.6% of the population. Type 2 diabetes, which makes up 90% to 95% of cases, is tied directly to metabolic dysfunction. We know poor diet, insufficient activity, and insulin resistance all compound the problem. Beyond the personal cost, diabetes drives enormous expenses for the country as a whole, with billions spent annually on related complications like heart disease, kidney failure, and neuropathy.
When you look at diabetes at the cellular level, it's characterized by insulin resistance and chronic inflammation. Over time, those insulin-producing beta cells in the pancreas can become dysfunctional. This is why we see many people on long-term medications or insulin therapy, which manages blood sugar without always restoring proper metabolic function. Effective solutions need to address those underlying factors, such as restoring healthy glucose uptake and reducing chronic inflammation.
Let's talk about obesity, which now affects 41.9% of adults and about 20% of children. It's a driving factor behind multiple chronic diseases, from heart disease to diabetes and some cancers. Unfortunately, mainstream approaches still often emphasize counting calories rather than recognizing that metabolic health, inflammation, and insulin resistance are key to effective long-term weight management.
Exactly. Quick fixes like Ozempic, a popular weight loss injection, have gained immense attention. These drugs might temporarily suppress appetite, but they don't resolve underlying metabolic issues. Once the medication is stopped, The so-called Ozempic rebound occurs, where the weight returns. Real solutions need to focus on improving mitochondrial function, supporting insulin sensitivity, and removing harmful factors like ultra-processed foods and industrial seed oils, which disrupt healthy metabolism.
Autoimmune disorders are also on the rise. Conditions like rheumatoid arthritis, psoriasis, type 1 diabetes, and thyroid diseases, including Graves' and Hashimoto's, impact millions. These illnesses involve an immune system that attacks the body's own tissues. Research points to cellular stress, mitochondrial dysfunction, and disordered cell signaling as key contributors. So, once again, we see how important cellular health is.
In autoimmune conditions, stressed cells sometimes release mitochondrial DNA, which triggers inflammatory responses. Chronic inflammation and disrupted signaling with cytokines can then damage tissues over time. This cycle of inflammation can be difficult to break, but understanding it gives us a chance to target the root cause. Lifestyle interventions that support mitochondrial health can help reduce symptom severity and improve overall well-being.
Let's address a major concern. We're spending more years in poor health than ever before. Even though life expectancy has rebounded to 78.4 years, in 2023, after recent declines, many people face up to 12 years dealing with chronic ailments. This means multiple medications, hospital visits, and surgeries that reduce quality of life. Statistics show nearly half of Americans take at least one prescription drug, and many take 3 or more.
Yes, and these medications often become lifelong routines for managing conditions like hypertension, high cholesterol, or diabetes. They don't necessarily fix the root causes. Disabilities are rising as well, with more than 61 million Americans living with mobility issues, chronic pain, or fatigue. Again, much of this is linked to preventable chronic illnesses that stem from metabolic issues and inflammation.
Another topic in the spotlight is the supplement industry. People frequently turn to supplements to fill nutritional gaps or to address specific health concerns. However, not all supplements are equal in quality. Many are manufactured by profit-driven companies using low-quality ingredients and misleading labels. That means consumers can end up taking products that have limited or no beneficial impact on their health.
Precisely. Supplements can be helpful when used to support an otherwise healthy lifestyle, but we can't expect them to undo years of poor dietary choices and inactivity, especially if those habits haven't changed. Unfortunately, regulatory loopholes allow companies to market products without rigorous proof of efficacy. Consumers should look for trustworthy brands that prioritize potency, purity, and bioavailability while continuing to focus on nutrition and exercise.
With all this in mind, we should discuss the bigger picture. This modern health crisis is largely driven by a system that targets symptoms instead of highlighting prevention. Chronic diseases do not have to be an inevitable part of aging or genetics. By addressing the cellular roots of disease, focusing on nutrient-rich foods, movement, and avoiding toxins, we can begin to reverse these alarming trends.
That's an important message. Real solutions move beyond prescriptions and quick fixes. If we continue down the path of simply managing conditions, the rates of obesity, diabetes, heart disease, and other illnesses will keep climbing. The good news is that the body has an incredible capacity to heal. By emphasizing cellular health, we tap into the body's built-in mechanisms for repair and regeneration.
Before we close, let's run through a few frequently asked questions that our listeners might have. First, why are chronic diseases still rising despite massive healthcare spending?
The short answer is that our system prioritizes expensive interventions for symptoms. We have a massive pharmaceutical sector designed around disease management, not true prevention. Billions go into treatments that don't address root causes like poor diet, metabolic dysfunction, and exposure to toxins. Unless we shift our focus to these foundational issues, we'll continue to see chronic diseases increase.
Next question. What role do metabolic health and lifestyle play in conditions like cancer and diabetes?
They are crucial. Chronic inflammation, insulin resistance, and mitochondrial dysfunction all create an internal environment where cancer cells can flourish and where type 2 diabetes can develop. Improving metabolic health is key to reducing the risk of these serious diseases. Avoiding highly processed foods, staying physically active, and managing stress effectively can be game changers.
A third question is about obesity and weight loss drugs. Why haven't we solved the obesity problem, and are these new weight loss medications the answer?
Obesity persists because it's not just about calories. Metabolic damage, insulin resistance, and hormonal imbalances need real solutions. Injections like Ozempic can temporarily reduce appetite, but the underlying issues remain. Once you stop taking the drug, you regain the weight. True success requires improving insulin sensitivity, supporting mitochondria, and avoiding the processed foods that undermine cellular function.
Final question. What's the single biggest takeaway for reversing this crisis?
The key is addressing health at the cellular level. Conventional medicine often waits for problems to arise, then steps in with medications and interventions. If we focus on nourishing our cells with proper nutrition, reducing toxic exposures, and engaging in regular physical activity, we can reverse or even prevent the majority of chronic diseases we see today.
Thank you, Alara. This has been an in-depth look at why our healthcare system, despite its massive budget, remains ill-equipped to stop the surge in chronic diseases. If we want to change the outlook, it's clear that focusing on metabolic and cellular health must be our priority.
I appreciate the opportunity to discuss these issues, Ethan. Empowering people with straightforward information is the first step toward real transformation. Chronic diseases don't have to be the norm. We can make better choices and demand more from the entire health system, from medical professionals to manufacturers of supplements.
And that wraps up this episode of Dr. Mercola's Cellular Wisdom. Thank you for joining us. I'm Ethan Foster, here with Alara Sky, and we look forward to bringing you more insights on how to optimize your health from the inside out. Take care until next time.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.